person of average height or above, you can't really imagine how much of an effect being short has on your life. Now, for some people, usually men, the effects of being short are so severe that they're willing to take on a painful, expensive surgery to add a couple of inches to their height. Here to talk about the long and short of limb lengthening surgery, we have Dr. Shahab Mahboubian, an orthopedic surgeon who performs limb lengthening procedures. Akash, Shukla, at 4'11.5" he underwent surgery and wrote a book about the process called Measure of a Man. Stephen Schaefer, he's scheduled to undergo the surgery this month because his legs are 2 different lengths. And Alan Mott, a blogger who's written about his life as a short man. Welcome, everybody.
Hi.
Hey, how's it going?
Well,
how are you?
I'm so glad that you're here. I've talked to a lot of you already, and I can't wait to have this conversation here on HuffPost Live. We have here on the Huffington Post Cosmetic Leg Breaking, what some men will do to be taller. We have this picture here, but a picture doesn't always tell the whole story. Dr. Mahboubian, can you explain what this surgery is and how it works?
Sure, of course, it'd be my pleasure. First of all, I'd like to thank you for allowing me to join you and kind of talk about this relatively new procedure that I've termed height lengthening. So, you know, there are a lot of people that are very short, and of course, that's something that really bothers them. Not only does it affect their self-confidence, but it also prevents them from having a lot of opportunities that other people have. And I mean, that's a lot of different things that I could list. One of them being job opportunities, another one being able to date the woman of their dreams, and so on and so on. So basically what the surgery entails is that there are certain devices that allow for the legs to grow longer. Basically what I do is I do a surgical incision in the bone, and with an internal or an external device, the bone and the leg is lengthened about 1 millimeter a day, sometimes a little bit slower. And because it goes at such a slow rate, usually patients don't have too much pain. Now, of course, pain is relative. So it's not the worst procedures. Technology has really advanced in just the last couple of years, where now instead of putting on an external device that used to be extremely painful, to now an internal device, which is a lot less painful and a lot more tolerable.
Well,
so
and when we're
what
talking
happens
about,
is that,
wait, I want to get back to that, because when you mention pain, there are levels of pain. And Akash, first of all, am I pronouncing your name properly now?
Yes, yes, you are.
Great, Akash. We have here your website, Akash Shukla, Measure of a Man is the title of your book. And here's the before and after picture where you're about the same height as your mother. And after, you are obviously much taller than your mother. When we're talking about the pain involved, where would you rate this? What can you liken the pain in your experience of having this surgery?
You know, in my book, I talk about this in quite a bit of detail, where I asked my dad when we first found out about the surgery, I asked him, is it going to hurt? Will it be painful? And he said, yes, it's going to be painful. This is going to be more painful than anything you can ever imagine. But the pain will go away, and the increase of height that you get will stay with you for the rest of your life. Speaking about the pain, yes, it was very painful. There is nothing in the world that can prepare you for pain like this. I tried to deal with it by watching reruns of my favorite TV show, Friends, or watching Bollywood movies, or anything that could take my mind off it.
And so when you're dealing with this pain, when you're watching the Bollywood movies, during this process, how long did it take and how much height did you gain?
Sure. I had the surgery, the first surgery, where they added the external rings in September of 2004, and the lengthening went on for about 3.5 months. And those rings were removed in January of 2005, after which they added IM rods to make sure the bone fused properly. And after that, it was by around mid-February that I was able to walk properly without assistance.
And
the rings, I'm sorry, allow me to expand on that. The rings that Akash is talking about, this is almost like an old technology where they used to have these external devices with pins going through the bone. And as you stretch it out, these pins actually cut through the muscle and the skin. And yes, it used to be very painful. But now that everything's internalized and, where we use an intramedullary rod, which is a rod inside the bone, the pain level has dropped dramatically and it's a lot more tolerable now.
Well, but luckily that's for what Steve is going to experience, the new technology in this, which wasn't available until now. But really quickly, I just want to ask Akash, you got the surgery then, you gained 2.5 inches, am I right?
Yes, that is correct.
Was it worth it?
Yes, it was, without question, it was absolutely worth it. I mean, before I had the surgery, as you mentioned, I was 4 foot 11.5 inches. And for a man, that is a very, very small height. And I felt a kind of sadness, not about just my height, but about the fact that I couldn't do anything about it. So it was an addition of those two things that kind of prompted me to get the surgery. And I came out of it a much more confident man, a much happier person, and it really has changed everything.
And sometimes, Stephen, it's not just about height. I think one of the things we frequently think of these surgeries as, oh, well, just a couple of extra inches, it doesn't necessarily matter. But it can especially matter in situations like yours when one of your legs is longer than the other.
Incredibly, it really does. I do a incredibly physical, hardworking job, and I was involved in a major car accident in November, which left me a spinal injury, and leg lengthening was my only result to maybe, hopefully, in the future, getting rid of my back pain.
And so when you're talking with Dr. Mahboubian about the surgery that you're about to undergo, what are some of your biggest fears? What are some of your biggest worries about undergoing limb lengthening surgery? Stephen?
Yeah, you're.
Oh, I'm sorry. I think your connections. We're going to work on getting you on the phone. But Dr. Mahboubian, I'm sure you can answer that. The reason I ask is because we have a question here from 113. I wonder what the long-term effects of this procedure are.
Well, that's a very good question, and it's a very valid question because everybody wonders, well, if I have my leg cut, what's going to happen to me? Am I going to be able to play sports? Am I going to be able to walk? Am I going to be able to do everything that I was able to do before I had the surgery? And I can...
not being able to get the rod out of my leg and having to go with an external device. Can you hear me?
Yes, I think you did. I think he was explaining the different fears people had, and you just jumped in there with your fear. And it's a legitimate one. I think it's legitimate, especially, doctor, because many people who might not have the resources. How much does one of these surgeries cost in America compared, doctor, to a surgery perhaps in a third world country? Dr. Mahboubian?
I'm sorry, can you repeat your question?
I think one of the reasons people are especially afraid is because if you Google limb lengthening surgery, frequently you get horror stories from individuals who did it outside of the United States in less expensive areas, because the surgery is quite expensive here.
Yes, it is expensive, and unfortunately, the cost of doing the surgery is a little bit more compared to third world countries. However, if you look at the benefits that you're going to be gaining, because you're going to be getting first-rate service and care from a U.S. organization or hospital, as well as a doctor who do these surgeries. And I've heard plenty of stories of patients that have gone overseas because it was cheaper. And I mean, they come to me with their disasters because they develop so many complications when they go outside of the country. They don't use the proper material because they're using cheaper material. They don't have the proper follow-up, again, because they want to keep costs down for themselves. So there's a lot of disadvantages by having a cheaper procedure by going outside the country. Now, in the U.S., we provide the best that is on the market. Everything is FDA approved. So everything is going to work properly. And if anything goes wrong, I'm always on top of my patients, making sure that they make adjustments and making sure that they reach their goals and completely recover from their surgeries, and of course go back to doing what they were doing before surgery.
Well, can I jump in a second,
yes,
please?
Please do.
This was a question that I really struggled with a lot, asking myself, will there be any long-term effects? I mean, this is such major surgery on your tibia and fibula bone. And I can say without a shadow of a doubt that there is nothing that I could not do before the surgery that I can't do now. I run in a 5K every year. I exercise quite regularly. I don't feel pain at any time when it's cold or whatever. So there is no limitation on any physical activity whatsoever.
Well, that's good to know, and it's good to know that you had a good doctor like Dr. Mahboubian, and who I know that you mentioned in your book, Measure of a Man, who your doctor is. Alan, I want to get you in here. You're being quiet. You're being patient. I'm so grateful that you're in here because I read your piece here on thegoodmenproject.com. I'm a short guy. And here's a picture of you. And what I liked about this piece is it's interesting. You talk in such an eloquent way about the issues you deal with, and in a way that many people might not have been able to relate before. You talk about it and you equate it to the gender bias, and it's something that a lot of people would say, what does being short have to do with being a woman?
Well, that was sort of the interesting thing I found when I started writing the piece, was that there are sort of some similarities towards being a short man and being a woman in terms of some of the discrimination you face. I'm not saying that it's equitable, but there are some similarities. And one of them, for example, I found was in terms of wage disparity, was that if you read Malcolm Gladwell's bestseller Blink, he talks about how an inch of height can mean the difference of something like $789 a year of salary, which doesn't sound like much until you think about that a guy who is like a foot taller than I am, I'm 5'2", so he's 6'2", he'll earn $400,000 more over the course of a 40-year career, which is that's almost $500,000 based on just height alone. And so some stuff like that is sort of things people don't realize, is that height matters. It has an impact.
And that's one of the things that when you talk about it, a lot of people ask. We actually had a question here, what is your evidence that height influences pay check size? And we have here, my girlfriend actually wrote this book, The Tall Book. She's here on the Freakonomics website talking about that. It is actually true. The studies do show that for every inch, you earn over $700 more a year statistically. And in your situation, when you're listening to these stories, I'm sure this is not the first time limb lengthening surgery has come into your experience. What are your thoughts on experiences like this?
To me, it really depends on the individual. Someone like Akash, who is he actually got the surgery to get to my height, and knowing what it's like to be 5'2", I can totally understand why he would do that. But then you hear other stories. Akash was telling me before we went online that somebody contacted him who was already 6'1" and who wanted to get the surgery. In a case like that, to me, that's insane. I mean, why would someone go through that level of pain just to hopefully get to 6'4"? I mean, that's a sign that sort of it really depends on the person. I mean, some people it really is going to make a significant change in their lives, and other people it's just going to be purely cosmetic. And if it's purely cosmetic, I mean, I'm not sure if it's worth it.
Well, and it's interesting because sometimes, Dr. Mahboubian, it's very much like breast reduction surgery or lap band surgery. There always are instances where it's abused, but then there are things that seem like they're cosmetic but actually are for legitimate reasons. Like Stephen, you have here on your website, there are cases like height lengthening. Here's another patient of yours that increased his height at the ages of 19. But you also have situations like bilateral bowform deformity, femur lengthening, and humeral lengthening and tibial lengthening. I hope I'm pronouncing these things correctly. And hand deformity. Even the same surgery that is used to make people taller can be used for the hand. So I think that's an interesting aspect.
Yes, it is. And, this whole idea of limb lengthening was developed because of deformities. And then they realized that as you stretch the bone out, bone can grow. And initially it was used to correct limb length discrepancies, bone length discrepancies, meaning one leg is shorter than the other, just like Stephen has. However, over time, people decided, well, you know, why can't we use this to make both legs taller? What's the difference if you cut one bone versus, one leg versus both legs? And if you could do that, not only can you correct the bow leg correction and make them straight, but at the same time, you can make them taller. So there are a lot of people that have an issue with their height. And so that's why I decided, you know, I want to help these people because there is something called heightism, which I'm sure Akash will explain a little bit better.
Well, yeah, and Akash, and speak to that, because I think that one of the things that I saw on your website, Measure of a Man, that was interesting was a conversation your mom had with a family friend with daughters. Can you share that with us? Yes. When I kind of made it official that I was going through the surgery, a bunch of family friends voiced concern, asking, you know, why is Akash having such a gruesomely painful surgery? And one of my mom's family friends, their daughter asked the same question. And my mom said, would you date a guy who was as short as Akash? And she said, no, I wouldn't. And my mom said, that's your answer. Now, the whole point of this was not only so I could date taller girls or anything like that, but that was a part of it.
That was something that I discussed in my article. Is that I found a interesting thing. Is it's something a lot of women don't want to admit, is that they do sort of prefer taller men. But then I've also had many instances where I've specifically asked women who have gone like, oh, I'm sure there are a lot of women who would love to date you. It's like, well, would you date someone who is shorter than you are? And if they're honest, 90% of the time they say no. But you know what? For every majority thought, there always is the minority. There are, as you have experienced and as you write about in your piece, there are lots of women who love a shorter man. There are many people who would say, hey, there can't be a television host that's tubby. Or there may be people who say, hey, there can't be a black president. But these are great examples of the minority ending up in the majority. So I'm so grateful for all of you joining us to share your experiences, your thoughts, and your knowledge. And Stephen, we wish you the best of luck with your surgery. And we hope to have you back to hear how it went. And we hope that your limb lengthening surgery corrects your issue. Akash, thank you for sharing your wonderful journey and your wonderful book. Alan, thank you for being a good man and writing for the Good Men Project. And thank you for watching. Please keep checking out what's coming up next, because we've got more great conversations coming up, courtesy of Cadillac.